And good evening, everyone. Fred Shropshire here with WCNC Charlotte. I want to give a warm welcome to our Facebook viewers and also the folks on our YouTube channel. If you're joining us tonight, it's because we've been talking about this for quite some time. We're talking about the COVID-19 vaccine for children. We'd had this planned for quite some time. Call it kismet, call it luck, or just good television planning. But today, this is a good time to be talking about this because the CDC panel recommended the Pfizer COVID-19 vaccine for children ages 12 to 15. So we're going to be talking about that this evening. We're going to be answering your questions. I hope you've come armed with questions. I'm not going to answer your questions. We have a panel of distinguished guests here to answer your questions. We have Dr. Charlene Wong, who's the Chief Health Policy Officer for COVID-19 with North Carolina Department of Health and Human Services. And we also have Dr. Charlene Ohmstede, a pediatrician with Novant Health Dilworth Pediatrics, who is the physician lead for Novant Health Children's Health Institute. Thank you, doctors, both for being here this evening. I really appreciate it. I know our folks who are watching are going to get a lot of knowledge from what you're going to offer this evening. Before we jump into the questions, though, I just want to give you an idea. Be sure throughout this, if you have questions, to type them in. We'll get them answered by the physicians here, the experts, while they're here at your fingertips. But we've been talking about this via our Verify reports. There's been so many questions about the vaccine, so many questions about the pandemic. There's so much information out there because of the internet. And here at WCNC Charlotte, we have Verify. So we have a Verify report from one of our reporters, Rachel Lundberg, to give you an idea of the questions we've been getting online and on social media.
A lot of parents have questions about the shots their kids will get. So let's verify. Will kids receive the same COVID vaccines as adults? Our sources, Pfizer, Moderna, and Johnson & Johnson, and an infectious disease expert. Pfizer and Moderna have made it clear that kids 12 and up will receive the exact same two-dose regimen as adults. A spokesperson for Pfizer tells me it's the same formulation and administered at the same level. Moderna spokesperson called theirs the same vaccine, same dose. Both companies started their adolescent trials months ago.
Why wouldn't they need to modify the vaccine?
Well, because immune systems of children are wonderfully responsive.
Dr. William Schaffner is an infectious disease specialist at Vanderbilt University.
The immune systems are not calibrated according to the size of the child.
But Pfizer and Moderna may modify the dosage for children under 12. Those trials just started, and they're still figuring out the right amount for each age group. Pfizer's standard dose is 30 micrograms, but for kids 2 to 11, they're testing 10 micrograms, then moving up to 20 and 30, depending on the age group's tolerance. They did the same thing during the adult trial. Moderna's strategy is similar. Their standard dose is 100 micrograms, but for children 2 to 11, they're testing 50 as well. And for kids under 2, they'll test 25 micrograms up to the full dose.
The investigators, as they go down the age range, and of course, the children get smaller, are trying to adjust the doses so that the children get good protection, but keep the side effects to a minimum.
Johnson & Johnson is well behind the other companies and just started their trial for children 12 and up. At this point, we don't know if they'll adjust the dosage for kids. So we can verify if they get Pfizer or Moderna's vaccines, kids 12 and older will get the exact same shots as adults, but children under 12 may receive smaller doses. Those younger kids are still months away from an authorized vaccine. With your Verify, I'm Gabe Cohen.
Okay, that was Gabe Cohen, not Rachel Lundberg, but you get the idea. There's so many questions talking about the dosage. I want to bring in Dr. Charlene Wong and Dr. Charlene Ohmstede to answer our questions now. I'll just kick it off. One of the questions that I have as a parent, I have a son who has a peanut allergy. Is this a vaccine that kids who have allergies will be able to take?
We do recommend that children who have allergies get the vaccine for COVID. All of our vaccine sites are prepared for any kind of allergic reaction and have EpiPens and Benadryl on site, as well as emergency management. So parents who have children with allergies should feel comfortable that they'll be in very good hands. We do ask that, just like adults when they get their COVID vaccine, children wait for a 15-minute period after they get the vaccine, since we know that most vaccine reactions are going to happen the first few minutes after the vaccine is given.
Mm-hmm.
And I'll add, those sorts of allergic reactions are very, very rare, particularly the serious kinds, which are called anaphylaxis. And for those, it's for children who've had children or people who have had a history of that type of very severe allergic reaction called anaphylaxis in the past. That might put them at a little higher risk of that, but again, a very, very rare event. As Dr. Ohmstede said, all of our vaccine providers are well prepared to deal with that if it happens, and again, very rare.
When might kids be able to start getting that vaccine?
So children who are 12 and up are now approved and ready to get vaccinated. And in Charlotte, children can go to vaccine sites where adults would go tomorrow. Novant started vaccinating some of the team members' children today. My own children got their vaccine tonight. It was really exciting. It was really fun to see all the energy in the vaccine center. And those sites will be open for walk-ins tomorrow after 3 p.m.
Is there any concern about what kind of reaction or what kind of participation we might see from this door being opened to kids ages 12 to 15? I mean, we've seen the interest and the excitement kind of wane among adults. Is that an indication of what could be for children, or are you optimistic based on what we've seen so far with adults?
I think I would say we're pretty optimistic that we know for sure there are a lot of teens and parents who are looking for the vaccine. I would say at the state, as soon as the FDA extended the authorization, which was on Monday evening, we immediately started receiving calls. I'm sure you all did too at Novant, saying, hey, when can I get my child vaccinated? That being said, I think we anticipate that this will look something similar to the way that it has looked in adults, where we had a real rush of folks, particularly when we had very limited supply of vaccine. And then we'll really need to continue to use all of our different tools to help make sure parents and teens have the information they need to make informed decisions, and really encourage just as many people as possible in North Carolina to get vaccinated as quickly and fairly as possible.
The timing is actually perfect because, as you said, many of the adults who wanted to get vaccinated have been vaccinated now, and our vaccine centers have the capacity to take a larger volume. And within Novant, we have 60,000 children in the Charlotte area who are between the ages of 12 and 15. And so we are ramped up and prepared and ready for those kids to come in as soon as they can. So we're ready. We have vaccine. We have staff who's ready to go. So we are well prepared for that capacity.
Very good. And we just a reminder that our viewers watching right now can chime in by asking your questions. We're going to be asking those questions to our doctors here on our panel. The first question I see here is from Karen Beltran. She says, how about kids with cancer? My daughter is in remission from a brain tumor. She is 5 years old. My daughter had 3 stem cell transplant, so she doesn't have her immune system so strong like other kids. Are there concerns for kids like this?
Wow, Karen, it sounds like your family has been through a lot. And I'm sure this past year has really added to the stress of having COVID out there. I would contact your oncologist and ask them what they recommend. Depending on where she is in her recovery from her stem cell transplants is really going to determine what the recommendation is going to be about when to vaccinate. But we do know that the vaccine is very, very safe, even in children with underlying health issues. The real question is going to be if she is in a position to mount a sufficient response to the vaccine right now where she is in her treatment. So I would reach out to your oncologist and ask them if when would be the right time for her to get vaccinated.
I know that in the top of the beginning of our introduction here, we played that Verify report where they were talking a little bit about dosing. Can you go into a little more detail about how that dosing will vary from those kids who are 12 to 15 years old, and perhaps depending on what happens with the vaccine with kids younger?
So for our 12 and ups, it's the same dosing as we have for our adults. Right now, there are clinical trials going on down to age 6 months. And just like when we're looking at different medications we use in younger children, the younger they are, the smaller they are, we adjust the dosing. And that's where we really want to make sure that that dose is the right dose for children of different ages, because you want to make sure that it works and that it's safe and doesn't give too many of those temporary reactions.
Okay. We have another question from Leah Andra. She says, my child will be 12 in August and has a history of allergies. Will the vaccine be safe for her? Specifically concerned about what you just said, anaphylaxis.
So as Dr. Wong said, anaphylaxis is extremely rare with this vaccine, and children who have food allergies or have other kinds of allergies do very well with the vaccine. We are prepared for any kind of reaction, of course, and know those are very rare. If your child has had a severe reaction, has been hospitalized for an allergic reaction in the past, I would call your allergist before you go get the vaccine to ask if there's any pre-medication they would recommend or anything extra that you would want to do to be prepared to get the vaccine safely.
Very good questions from Leah and Karen, both thank you. Just a reminder to our viewers, keep those questions coming. Looks like it says, where can I make appointments for my 15-year-old twins to receive the vaccination? That's from Kim Kaminsky.
So the Novant vaccine centers, there are 3 in Charlotte. One is on Freedom Drive, one's on Independence, one in Huntersville, and then there's a 4th center in Salisbury. And those clinics are going to be open for walk-ins tomorrow after 3 p.m. for 12 and up. If you want to make an appointment to make sure that your time is reserved and make sure a dose is reserved, you can go to Novant's vaccine website, which if you go to getvaccinated.org, that will shoot you over to Novant's vaccine scheduling website. And whether you're a Novant patient or not, you can make an appointment there. And those appointments will open at 3 o'clock tomorrow for the 12 to 15-year-olds, or you can walk into any of those sites, which are listed on that website as well.
And then I'll add for additional sites, you can go to myspot.nc.gov and search for a vaccine site that's near you, including you can see on that website which sites have the Pfizer vaccine. Want to emphasize it's really important for our 12 to 18 right now, or 12 to 17. It is the Pfizer vaccine that's currently authorized for that age group.
I wanted to get to this question by Loretta Newman Morgan, who says, my son has type 1 diabetes. Should I have him vaccinated? He has several allergies to a lot of different medications.
So again, children with type 1 diabetes are a higher risk group than the general population of children. So this is a group that's going to be very important to be protected from COVID. I would call your endocrinologist and make sure that your diabetes is in good control, but diabetes itself is not a contraindication to getting the vaccine. Again, if you have both allergies and diabetes, I would check with your allergist and your endocrinologist before you go get vaccinated.
And just to be really clear, the only direct, what we call contraindication to getting the vaccine is if you have an allergy to one of the ingredients in the vaccine.
Okay. I have a question here from James Sutton, who says, what is the difference between FDA authorization and FDA approval?
So FDA authorization, or this emergency use authorization, is a great tool that allows us to get really important critical treatments and preventive medications like the vaccine out to the public more quickly during a public health emergency. It is important to know that these vaccines are tested and have been found to be safe and effective, going through a process that is very similar to the approval process. And it's really making sure that we can get these vaccines that are so important and critical to the public health of the US and to the world out more quickly. We also know that the companies that have made these vaccines are also seeking their full approval as well, which again, doesn't mean that they need to do any additional testing, because they've already done the very, very rigorous testing to have these vaccines out after they've proven that they're safe and that they work.
Mm-hmm. A question here from Gretchen Calder. She says, what about long-lasting effects to kids?
We don't know yet what the long-lasting effects of COVID infection are to kids. There definitely are children who present with long COVID the way adults do. And we are very concerned about long-lasting effects of infection. Most vaccines, if there's going to be a reaction, it happens very shortly after the vaccine is given. It is very unlikely for a vaccine to cause long-term effects.
Mhm. We're talking specifically about the vaccination among that group, the 12 to 15-year-old. Another question from Karen Beltran, who says her son is 11 years old. He really wants to get this shot. When will the other kids be able to get their vaccine? I know a lot of parents probably have the same question.
So it's really important, and this is how we can have so much confidence in these vaccines, is that they're really rigorously tested in each of these groups to make sure, again, that they work to prevent COVID-19 and that they're safe. Right now, the Pfizer vaccine, the Moderna vaccine are and as well as actually the Johnson & Johnson vaccine are testing in children. Specifically, Pfizer and Moderna are having clinical trials right now in younger than age 12. We need to wait and see the results of those trials. We do hope that they will be as good as we have seen for this 12 to 15-year-old age group, which really show that the vaccine works incredibly well in our younger teens, as well as is very safe.
Can we pop that question up by Rachel Spear Donahue here, talking about the data? Says the data I've seen says that only a little more than 2,200 adolescents were in the test group. That seems like a small test group. If so, why such a small number? That question again from Rachel Spear Donahue.
So this was the test group of 12 to 15-year-olds that Pfizer used to get the emergency use authorization. But of course, we've been giving the vaccine to 16 and 17-year-olds for months now, and there are many, many thousands of 16 and 17-year-olds who have done very, very well with this vaccine. In fact, just within Novant, we've vaccinated 7,000 16 and 17-year-olds with very, very low incidence of any kind of mild reactions and very good response. So I think we can feel very comfortable that we can extrapolate down from a 16-year-old to a 15, 14, 13, and 12-year-old. And that's why the groups were divided up by age. And we're not jumping in with 2-year-olds yet, but 12 to 15-year-olds really are going to react very similarly to a 16-year-old.
Yeah. A question here from Philip Ganisi. So just for clarification, just to clarify, Pfizer is the only vaccine that kids are getting, can get right now, correct?
That's correct. And so when you're looking for a place to get your child vaccinated, if they are 12 to 17, it's really important to call and make sure that it is the Pfizer vaccine that they have. And again, on that website, I mentioned myspot.nc.gov. You can look and find a vaccine provider near you, and each of the provider listings includes which vaccine that provider has on hand.
Yeah, some very good questions coming in from our viewers. Okay, so this is another question by James Sutton. Should children who were previously infected and recovered from SARS-CoV-2 receive the vaccine, and what clinical studies have been done on children who have had the infection? Related to question is, why should one who has recovered receive the vaccine, since the natural immunity has been proven to last at least 8 months and possibly years? It's an interesting question there.
Dr. Ohmstede, do you want to? I'll go first on the natural immunity piece. We get this question a lot. Dr. Ohmstede, I'd love to hear also how you answer this question. So it is true that you get some natural immunity. What that means is if you've been infected with the virus that causes COVID-19, you receive some protection naturally from having that infection. The challenge is that while some people will have very strong and long-lasting protection from that natural immunity, some people are going to have less strong, less long-lasting immunity. And what's really hard to predict is who's going to be in which of those groups. We do know there are people who have had COVID-19 who have gotten reinfected with COVID-19. With the vaccine, you can be more confident that the level of protection you're going to get is very strong and that it's going to be long-lasting. And that's something that scientists, we continue to monitor. We already know that it's very, very strong protection for at least 6 months, and we expect it'll be longer as we continue to monitor that.
I agree completely. And, we've had many cases where a child or an adult tests positive for COVID and we draw antibodies and the antibodies aren't there. And so we don't have as good data that there's a robust antibody response to natural infection, whereas the vaccine was studied based on looking at those antibody responses. So we do have really good data that the vaccine will bring on that immune response. So we do encourage anybody who has had COVID infection to also get fully vaccinated.
Very good questions coming from our audience here. Here's something that's interesting because I know, when we're talking about kids, whether they be younger kids or adolescents, here's a question that I know will come up. Can this vaccine be given alongside other vaccines?
We're so pleased to say yes, that is something that was changed today. I think because we know that there's a really good safety profile for this vaccine, and when we look at giving other different vaccines together and it's very safe, we're very happy to say that starting today, yes, you can get this vaccine also with other vaccines. And this is so important because, as Dr. Ohmstede and I know, we have seen such a drop-off in kids coming in to get their routine vaccinations, which are so critically important. And so when folks are coming in to get this vaccine, if they're getting caught up on their other vaccines, they can also get their COVID-19 vaccine at the same time.
And we have been advising our 16 and 17-year-olds to not get two vaccines at the same time, mostly because we're watching so closely to see if there are going to be any reactions to the COVID vaccine. And if you got two vaccines close together, we wouldn't know. But the response to the vaccine has been so great, and the side effects have been so predictable and minimal that we really feel comfortable now that you can get the COVID vaccine with any other vaccine without any concern. So that is brand new advice that's probably contrary to the advice you might have gotten yesterday. And we are thrilled that when our adolescents come in for their well visits, that we can go ahead and get their vaccines on board and catch them up. You may know that adolescents are the group that fell the farthest behind among all pediatric groups in 2020 as far as coming in for their well visits and getting their vaccinations. So it's very important to us that we make sure that these children don't fall through the cracks. It's important to get their vaccines. It's important to get their height and weight and vision and hearing checked, but also it's really important for their mental health, for their pediatrician to have a chance to check in on how they've been doing through all of this. So we really encourage all of our adolescents to get in with their pediatrician or their primary provider as soon as they can.
Here's another question that goes along with that, I think. It says, will we need to get COVID-19 vaccines yearly, similar to the flu shot for adults and children?
So it's hard to know right now. I would say I think a lot of people do anticipate that we may need booster vaccines, and it's not because the vaccines that those of us who have been vaccinated have gotten are going to stop working. We are seeing these variants of the COVID-19 virus, and this is the same reason that for flu vaccine, we need a vaccine each year, except the flu is different each year, and we anticipate that might be the case for COVID-19 as well with these variants. And this is in part why it is so important also that we get as many people vaccinated as quickly and fairly as possible, because that will also help tamp down the risk of having more of those variants pop up, some of which may eventually start evading or our vaccines may not work as well against.
Got a question from Laura Lawson. Any idea when Moderna will be available for that age group? She says 12 to 17-year-olds.
So they finished enrolling their 12 to 17-year-olds in their trial back in February. And so we are waiting to hear the results of that trial. And then it will be a very similar process to what we saw with the Pfizer vaccine, where they'll go to the FDA, submit their data. The FDA will consider the data that they have. And then if it's authorized by the Food and Drug Administration, will then go to the Advisory Committee on Immunization Practices, or ACIP, at the CDC to make any recommendations.
A lot of the conversation when these vaccines were being developed and studied before most adults started taking them was the efficacy rate. That was a big discussion. Do we know how effective this Pfizer vaccine is among that age group of 12 to 15?
In the trial that was done on the 12 to 15 age group, the efficacy was 100%. So there was not a case of COVID in any of the adolescents who got the Pfizer COVID vaccine, which is phenomenal. That's better than most of the vaccines that we are used to giving our children. We're all thrilled with that results. And even in practice, we've seen that those of us who've been vaccinated over the past 5 months, the vaccine has been incredibly effective.
And I'll add to that, there have been additional studies done, what we call sort of real world evidence. How are these vaccines working, not just in the clinical trials, but as they've been used around the world? And what they have seen, and it looks like maybe that's coming up on the screen here, is that the vaccines work as well in the real world as we've seen in the clinical trials, which is really just fantastic.
Here's an interesting question from Rachel Spear Donahue. Once again, it says, is there any research that shows whether vaccinated people can transmit the virus?
The chances of getting COVID-19 once you've been vaccinated are incredibly lower than someone who's been unvaccinated. I would need to go back and look more specifically at the data. I think there is, because it's much lower chance that you would get it at all, and if you did get it, you would have less of the virus. The chance of someone who's vaccinated transmitting the virus is also quite a bit lower. And there are so many studies that continue ongoing around the world to get more of these data. But what I will say is, for the vaccines that we're using in the United States, the data that is coming out of all of these is so effective. It's just so effective.
There's another question here. I'll take a stab at this one. It says, if antibodies are sufficient evidence for showing immunity, why does the CDC still require persons who are fully vaccinated, including children, to show a negative COVID test to re-enter the USA when they have vacationed in another country, but individuals who recently recovered do not need testing to re-enter if the infection was within 90 days?
So one complication we have with infection is that the tests can remain positive for up to 90 days. And so it'd be very difficult to get a negative test within 90 days of natural infection. So that is one complicated nuance of this. I think that I'm not going to be one who's making the decisions about when we stop asking for tests for vaccinated people, but I'm sure that's on the table for discussion because these vaccines are so effective.
Mm.
Yeah, and we at the state are really following and very closely monitoring and in communication with the Centers for Disease Control, or CDC, who are updating their guidance as we get more and more of these data out about how effective these vaccines are.
Yeah. I think we've heard a lot about the risk to children, and that's been a big discussion because of kids going to school, still kids, some in remote learning. If children are lower risk for severe cases of COVID, why do they need to be vaccinated?
So most children are at lower risk for severe cases, but there are definitely children who have high risk conditions, and many of those children are too young to be vaccinated even now. In this country, we've seen somewhere around 500 children die of COVID. The estimates range 300 to 600 children have died of COVID. And in our hospitals here in Charlotte, we have had throughout the winter, many children become severely ill with COVID in our ICUs, and we've had deaths in our community in children from COVID-19. So even if your child is in a low risk category, getting vaccinated will protect their peers at school, their peers in the neighborhood, children in our community who are too young to get vaccinated or might not have the immune system required to get the vaccine.
And I'll just add to that, so many of my teen patients, they're really looking to protect particularly their younger siblings who live in the home with them, who are too young to be vaccinated, like Dr. Ohmstede mentioned. And I'll just also add another number out there. There have actually been 1.5 million 12 to 17-year-olds who have gotten COVID-19 during the pandemic in the US, which is just an astounding number. And then the other piece I'll add is that we also have patients who are younger. They may have had sort of a mild disease. They can have those pretty bothersome sort of longer haul symptoms like Dr. Ohmstede mentioned, or even more minor things, but that are bothersome, like their sense of smell never comes back normally again. And so again, we really want to protect kids from that. And it also can give them the peace of mind, give parents the peace of mind. They can be more confident their kids are going to be safe as they're doing things that are so important for children and teens to be doing. Hanging out with their friends, going to summer camp, going on family vacations, playing sports, making sure as many of our kids as possible are back in school in person, and people can feel much more confident that their kids are doing those things and that they're safe and protected from COVID-19.
And
I agree completely, Dr. Wong, and I'll add that just the nuisance of masking. I think we're all ready for our kids to go to school and not have to wear a mask. And the sooner we get all the kids vaccinated, the sooner that can be a reality.
I was going to ask you, in an ideal world, I mean, there's kind of a threshold on this whole discussion about herd immunity. In an ideal world, what is the threshold for the number or percentage of children that you would ideally like to see vaccinated?
So herd immunity is a really tough concept. No one knows what that number might be. What we know is that the more people we have vaccinated, teens up, now that are 12 and up are eligible, everyone can feel more confident as we go about doing things in public and returning back to our lives as normal. Everyone can feel more confident that they are safe against COVID-19, from getting COVID-19. I will also add that for our 12 and ups, that it's just important, again, that we get as many people vaccinated as quickly as possible. And it's so wonderful now that our 12 and ups are eligible as well.
Very good, very good. Talk to me about, let's go back to side effects. I know that there were side effects with different vaccines that we heard reports about with adults. Are there different side effects for children?
The side effects for children are very similar to adults. Adolescents have very robust immune systems, so we do expect them to have the expected effects. I would go in prepared to be fatigued. That was found in a majority of patients who received the vaccine. Maybe having a little bit of muscle aching overnight. You might have a fever, same things that the adults have, especially after the second dose. We've really found that the second dose has more of those expected effects because you already have some immunity that revs up as soon as that dose is given.
And I'll just add, it's, those types of temporary reactions we see in teens or adults are a great sign that the vaccine is working. It's giving your teen the protection that they need so that if they encounter COVID-19 in the real world, they'll be protected against it.
Yeah. And just to reiterate, I've got a question here that's popped up a couple of times and we've already covered it. But just to reiterate, we have a viewer asking when will the appointments be available? Those appointments are available now, correct? And they're available in the locations that you would normally be able to get a vaccination if you're an adult. Is that right?
They are. I think they may be asking specifically about on myspot.nc.gov. There are some of our vaccine sites from which you can schedule an appointment from directly within the myspot.nc.gov. That will be getting updated this week so that folks who are 12 and up can make an appointment in that.
Yeah.
And in Charlotte, at the Novant sites, the scheduling is turning on at 3 p.m. tomorrow. And so at 3 o'clock, patients can go to getvaccinated.org and schedule their 12 to 15-year-olds to get those appointments. And we're also accepting walk-ins at all the Novant vaccination sites.
Well, as we wind down our discussion and we take our final questions from viewers, I want to ask Dr. Wong, Dr. Ohmstede, any final thoughts that you want to leave with our folks watching about this vaccine that the CDC panel has recommended for use in ages 12 to 15? This is a big step forward in fighting this pandemic. Your final thoughts?
I would just say this was such an exciting day for us as pediatricians, as parents. We've waited a really long time thinking about where we were a year ago and the amount of isolation that our adolescents were in, and how this is really opening them up to have a summer that feels a lot more like summer ought to feel. More interactions with their friends, which is better for their mental health, more travel, more seeing family, and getting back to sleepovers and normal life. And I think that that's really important for our teenagers. This is a time in their lives when social connections are absolutely essential to their development and their growth. And the faster we can get them back into their normal lives, the better they're going to fare.
And I'll I'll echo those sentiments. I think it's just really important to remember, as we've talked about, that young people are also vulnerable or can get this virus just like everyone else. Getting them vaccinated is going to be our best way to protect our teens, prevent the spread of COVID-19, and protect others. And that's really what we need to do to really get back in control of our lives, get back to the people and places we love, and especially for our teens, get them those summers that many of them missed out on, unfortunately, last year because of the COVID-19 pandemic. And now with the timing of this authorization and this recommendation, we really have the chance to do that for our teens and for our communities.
It is a big deal. We get to make up for lost time, and just exciting to have the opportunity to protect as many people as possible. Dr. Wong, Dr. Ohmstede, thank you so much for your time. It's been very informative. I hope our folks watching have been informed and have learned quite a bit. I know I have. Thank you so much. Really appreciate you. And thank you to all of our folks who are watching us via Facebook, WCNC.com, and our YouTube channel. If you have any more questions or looking for more information, you can log on to our website, WCNC.com. We have a special section carved out with all of our COVID-19 reports and all of the information that's out there that we've verified. And I'll see you on the news at 11 o'clock tonight on WCNC Charlotte. We'll see you then.